It's so good to see you.
Yes, yes. How things going?
I'm
Yeah,
taking one day at a time,
right.
and I'm very happy to be here. And how are you doing?
You know, the reality is that I've been diabetic for 27 years. I cannot take a chance on getting sick, ending up in the hospital, never want to be on a ventilator. So I'm taking it serious, you know, and I'm encouraging the people in my social group, the people that I interact with, to take it serious. So it's been tough, but this is where we're at, you know. This is the hand that life dealt us right now.
Yeah.
We just got to figure it out.
Same for me. I've been really trying to figure out ways to take care of my mental health because, especially working in the community, doing talks, presentations, fighting for your own family members and your friends to stay
Right.
safe, it can be really hard emotionally. I had COVID myself with my mom, my husband, and one of my 3 children. And we also lost a loved one to COVID. And just seeing all of the devastation around us, it can cause a lot of emotional turmoil. So I've been doing a lot of self-care in between work, and
Right.
what's been keeping me strong and just taking one day at a time.
Yeah, you know, and I do have a question. As a friend, knowing that I'm diabetic, you know, what would you recommend for me? I'm doing all that I can to keep myself safe, and not only for me, but for the community.
I would definitely recommend, just even before COVID, the same things that you were doing to keep yourself safe and healthy, continue to do that. It is so important to stay physically active every single day. Like for me, I cannot just walk or jog. I
Right.
wake up every morning when I see people just jogging. I'm like, oh, I wish I could do that.
Yeah.
I stop after like 1 minute, like, oh, I'm tired. I got to stop. But for me, I have to play organized sports.
Yes.
So one tip that I give to help people stay physically active, if it's hard to do it by yourself,
Right.
stay physically active with others. So I'm very competitive, so I'm just warning you. But I love playing kickball, and I'm on a kickball team. By any means necessary, stay physically active. Continue to watch what you're eating. Or the reward system helps. This is just me speaking personally, but also research has shown too that if you, for example, stick with your exercise and eating schedule for a week, pick out something that you say, if I reach all my health goals, I'm gonna treat myself to this.
You know, I thank you for that because I'm finally at a point where I'm no longer beating myself up for, you know, the little bit of weight gain.
Yeah.
And you know, for anybody that is gaining weight, you know, during this period, I guess I focus on the fact that I may have gained a little weight, but I'm safe. You know.
I gained a little COVID pounds too, and I'm working on it. I lost some. Yes, I gained a couple extra pounds, but I'm gonna wear that with pride.
There you go. I like that.
Yes.
I like that.
So that's just one thing to just like, don't beat yourself up about it. But then on the other hand, do some of the other things that we've been talking about in the midst of, you know, not shaming yourself for gaining a little bit of extra weight.
Right.
Continue to stay active, continue to work on your eating habits. And one of the biggest things is getting accountability partners.
Yes.
You cannot try to go through this alone. So whether it's getting a walking buddy to walk with you, having someone to hold you accountable, that's really important. Just whatever you do, don't do it alone. We're all in this together.
I'm so glad you mentioned that because, you know, our Black Men Run group during COVID, this has been the best year that we have had because we have gotten a lot of guys come out. Hats off to the fraternity brothers. They've all come out and support us now. But every Saturday we get out to the Arboretum. We run or walk anywhere from 1 to 6 miles, and the group has just exploded. We're doing hiking now. But there is something about that social connectedness that I never valued until now. One of our biggest concerns was when the barbershops and black salons shut down. We were concerned about losing the sacredness of what we've established. You know, we wanted our guys to stay healthy. I mean, the pandemic is real. We have been doing the virtual groups, really focus on encouraging guys, because we started talking about guys getting vaccinated long before the vaccine was even approved.
Yeah.
Because we knew that we could not wait until the vaccine got here to try and encourage guys to get vaccinated. So we started talking about that in May of 2020.
Wow.
Yeah.
So I heard that you did a very successful vaccine clinic
Yes.
earlier, right when the vaccine came out. Tell me about that.
Yeah, you know, really it was just the coordination of it. It was reaching out and talking with all of the barbers. When we did our first vaccine clinic, we had literally about 103 people show up from the community to get vaccinated. So we're really pleased that we kind of set the stage for that.
That's so important because we know that in order to build trust, it's more than just having credentials. It's more than doctors just coming in their white coats, which is important, But in order to make people trust the vaccine or even having conversations about it, it needs to be not just with medical professionals or public health leaders, it needs to be with people that they trust.
Right.
And you're going to be able to reach a group of people that I'm never going to be able to, just because you have those years and years of relationships. And then there'll be groups that I'm able to reach that you might not be able to. And that's why it's so important that we work together.
Now folks are still calling us about, hey, we're hearing about the booster now. You know, now that I've been vaccinated by you guys, can you get me the booster? And so we're working on that now. And so we're just trying to follow the science, keep current on the information. But we want folks to get that booster, you know. And I don't know much about that, so can you help me understand the booster?
Yes, definitely. And I'm so thankful that you're continuing to have conversations as well. A lot of people use the word like, we need to go tell people or educate people, which is important, but I like to go at it with just having conversations back and forth. So I'm so happy we're having this conversation and you're continuing to have conversations. So the question about the boosters. So Delta variant is different. We're starting to see that even people who were vaccinated in rare cases can still get COVID-19. Okay. There's a few reasons for that. One is because, as I mentioned, this Delta variant is a little bit different, but also we are seeing that after you get the initial vaccine, there's a lot of ongoing research about this, but after a few months, it seems that our immunity from that is starting to go down a little bit. And so that's why it's important that you get a booster shot or an additional dose.
Got you. I know for me, when I heard that, I thought, oh, here we go again. But then I started paying attention to the science. And I thought, well, you know, Aaron, this is the next gradual step in that process of protecting yourself and being really fully vaccinated. I also have been having conversations with a lot of guys, and people are fatigued. They're fatigued. They're concerned. It's, to me, we're trying to keep putting out good information. But you know, one of the things that I've been trying to do is just make sure we're finding those locations that have credible information. So is there anything that you can recommend?
All of the local hospitals have great information. The local public health departments have very accurate and good information that I trust. Also, here at Wisconsin Department of Health Services, there's some amazing, excellent information. The CDC website is really good as well. So those are some of the places that I love to go to.
Okay, you said that magical word, trust. It is so important now. We get the guys together, and early on, I said to them, I said, guys, we literally have to focus on not looking back and assessing blame, but focusing on what's in front of us, you know, because that's very important, because we get kind of too caught up in talking about past. And I said, you know, living is in front of us. It's not behind us. And so we've really been pushing our guys to just focus on that messaging, focus on taking care of ourselves, on community. That's kind of what we've been doing, but it comes back to trust and being able to have those conversations with men and not feel like you're preaching to them.
Trust is more than just someone who's credible giving information or kind of slamming it down someone's throat. It's important that you have, yes, accurate information, but in addition to that, it needs to be coming from someone who is reliable, who's been in their life, is going to stay in their life in the future, even after this is over. And something really, really important, another aspect of trust is someone who you can feel safe with, physically and emotionally. So if you're talking to someone about, let's say someone is not ready to get the vaccine yet, but you come at them like, oh, well, if you die or something happens to you, don't say we didn't tell you. So do you really think that's helping? Do you think that's going to make them like, you know what, you're right, I'm going to go out right now? No, that solidifies the divide. It
Right.
makes it worse.
Yeah.
So you have to always just come from a place of love in everything, coming from a place of love, having conversations and just helping people to get
Right.
accurate information
Yeah.
and try to move them one step closer.
Yeah. You know, I have had conversations with guys who are not vaccinated. They have no interest in getting vaccinated, but we continue to push the information. I had one guy to say, you know, Aaron, why do you keep talking to me about this? You know where I stand. And I said to him, I said, man, I love you too much to not have this conversation with you. And letting guys know we care about you. And we want you not only to be, you know, safe, but we want your family to be safe. And that's kind of where I'm at with this.
What you said about I love you too much, that's what it's all about.
Yeah.
What we're seeing here in Wisconsin, what I'm seeing from some of my other healthcare colleagues from across the nation,
Right.
is that the hospitals, ICUs, they're overwhelmingly filled with those who are not vaccinated.
Yeah. Wow.
And it's not anything political. It's not a game. The numbers are the numbers.
Right.
Out of all, I have some colleagues that tell me about what's going on, like actual stories, what's happening in these hospitals and ICUs.
Right.
And it's heartbreaking,
Yeah.
where there are people who the moment before the breathing tube goes down as like one of the last ditch efforts to save their lives, they say, can I get the vaccine now?
Oh, wow.
And then the doctors have to tell them that it's too late.
Oh, wow.
And it's very heartbreaking. There's a lot of healthcare professionals, a lot of my colleagues that I know that are just very, very emotionally disturbed,
Right.
having to watch people die and know that there was something that it could potentially have prevented this.
Yeah.
So when you say you love them and you want the best for them, that's real.
Yeah. In your role, you're in the hospital. And so don't get to see what's behind those doors and what's happening there. But I'm concerned, obviously, about, you know, making sure that we're doing all that we can do to continue to reach and knock on the doors of those people that are not vaccinated. I'm going to continue to have these conversations with them. I know that it upsets them, but again, it just comes right back to, man, I just love you too much to not have this conversation with you. You know, but what is it like to be behind those doors and doing what you guys do? Because hats off to you healthcare providers. You know, I got nothing but mad love for y'all, you know, for what you guys do.
Yeah, thank you. I really appreciate that. Being a healthcare provider during this pandemic definitely has taken its toll. I'm not afraid to say it, and I'm very open about it because I advocate for taking care of your mental health. So I'm open about mine. I had to early in the pandemic get connected with a therapist that I meet with weekly because I'm like, if I am pouring out and helping other people, I have to take care of myself. You don't want to give from a place of emptiness.
Right.
You want to give from your overflow. So I meet with a therapist. I spend family time. I have a lot of hobbies that keep me happy and fill my cup so that I can then help other people. But as a healthcare professional, it's been very grueling. I'll never forget the first time I walked into the room of a patient who was COVID positive. And as I was putting all of my gear on, it was the closest I ever felt to if you are in the military and get recruited to go fight a war. Now, I've never been in the military. I have a lot of family who are, so I don't personally know how that feels, but it was one of the closest times in my life that I felt like I feel maybe a little bit of what you might feel when you get called off to war, knowing that you have to serve. You can't just turn around and say like, you know what, I quit. I'm not going in there. I'm going home. But those were some of the thoughts that went through my mind. Like, what if I walk in this room and I get it and then I bring it to my family and I die or something happens? It's very scary. But I said, this is what I signed up for. This is my role. I need to serve. And I am the doctor today. I'm going to walk in this room and do my job.
Yeah.
So it's very, very scary. And it's taken a toll on a lot of healthcare professionals across the country.
Yeah, you know, you mentioned about the mental health components. When we had to shut down all of the barbershops, I reached out to all the barbers and I said, you know, what can we do? We have to do something because we built this platform. We've established this trust. This is a sacred space and it's gone now. And so we all got together and decided that we were going to do that a 90-minute Black males mental health and well-being virtual support group. And to show you the depths of and the concern in the community, we started with just Madison, Wisconsin. We quickly spread to Milwaukee,
Yes.
Racine, when Kenosha had that officer-involved shooting there. Then we ended up getting guys from 38 different states
Yes.
joining us.
Awesome.
From Trinidad, Tobago, St. Lucia, Switzerland, Haiti, and Canada. But that told us that this mental health stuff is real. You obviously can't shame people when you know that you're treating something that could have been avoided. That has to take a toll on you.
That is something very real that's not talked about a lot, but we're having a real raw conversation today.
Yeah.
What's happening across the country, and I have heard personal accounts of it, there are many healthcare providers getting burned out,
Right.
leaving, quitting their profession
Wow.
because of exactly what you talked about. It is very, very devastating, no matter what the cause is, when you are taking care of someone and they die.
Oh.
When you have to go talk to that family member and the loved ones of someone who died, that crushes a part of your soul on the inside.
Right.
So when you're having to do that over and over, and you know that it's like, oh, there's something that I know could have helped prevent this,
Right.
it gets very difficult. So there's been a lot of healthcare professionals who have voiced concern about that. In the beginning of the pandemic, before the vaccines were out, it was like, there's no vaccine, we're just saving as many lives as possible. But once the vaccine did come out, there's a lot of moral conflict and a lot of burnout that's happening
Right.
as healthcare professionals are taking care of those who have not been vaccinated. Some of the pleas and cries that I've seen, whether on social media or just talking to other colleagues, some say that you will trust us when you're in a life-threatening situation and you get rushed to the hospital. You're putting your life in our hands to save you, and you trust what we're going to do in the hospital when we're saving your life. We're telling you and pleading with you, please get the vaccine. Why won't you trust us now when we're telling you this information, but yet you'll trust us when you get rushed in? But we have limited things that we can do to save you once you're here. And so those are just some stories that I've been hearing as I've been talking to other healthcare professional colleagues. A lot of it definitely takes a toll. So sometimes when I'm talking to people about this, I'll say, even if not for yourself or your community, think of your healthcare professionals, think of the healthcare systems that are becoming overwhelmed, and think about how your choices impact your healthcare professionals.
Yeah, powerful stuff. I'm so glad that we get to have this health center in this barbershop.
Yes.
And seeing the pride of guys coming in and knowing they still have to wear their mask, but they are so proud when they say, I'm fully vaccinated, but I am going to wear my mask because they understand. And so we're really pleased at what we're continuing to build here.
Yes.
And, probably the hardest conversation that I had was with a family member. They don't have a lot of money. And I had to have a hard conversation with him because he's living with chronic health conditions. And I was talking to him about getting vaccinated, and he was just sharing everything with me, every reason why he just wasn't going to do it. And I said, is it okay if we get burial insurance for you? And that upset him. And I said, here's the deal, man, that if something happens to you, we're on the hook for that cost. I said, so can we at least do that? We may not ever have to use it, but this is this is our reality, And that upset him so much that he called and talked to other relatives. Well, guess what? He's getting vaccinated.
All right.
But it was a hard conversation to have with him. I'm so happy that we didn't have to go down that road, but I was dead serious when I talked with him, because what I'm seeing on the news, I follow good science, but I won't hesitate to reach out to you, but we just want our community, our Black men, to be healthy. We want the community to be healthy, period.
And sometimes you have to show tough love and just have discernment of when to go there with people, when not, when it's more of a light conversation.
Right.
But that's why that trust is important. You had a relationship. If I were to come as a total stranger and be like, you need to get burial insurance, I might have been kicked out or never talk to me again.
Right.
But that's why it's important to have these conversations with people who are trusted.
Yeah.
And you already have that relationship, so you can do that.
And the bigger message that I have is, man, he pushed and pushed and pushed, but then he finally came around. And sometimes when you are trying to encourage people to do the right thing, they may push, but you just keep having that conversation and do it out of love, because ultimately I believe that's what won for us. So very happy with that outcome.
Yes. Oh, that's great. It's so good to hear that. And when we talk about COVID outcomes, we see that those who have pre-existing health conditions before they even get COVID, as you mentioned, diabetes, obesity, high blood pressure, other conditions, and then you do get COVID, you're at higher risk for being more seriously ill or hospitalized, poorer outcomes. So what you're doing is so amazing, because it's helping Black men get healthy just in general, which is great. But if they do get COVID, it's helping prevent poorer outcomes. Just baseline health is just so very important.
Yeah. These barbershops see a lot of men coming through here every month, so we know we're in a very unique position to reach them. And this is going to be here for a while. And are there any concerns with any additional variants coming around? Or
the more and more that the virus that causes COVID-19 has time to transmit to other people, the more opportunities that it has to mutate and change.
Oh, wow.
So the faster we can get COVID-19 under control, the more people we can get vaccinated, the more we can stop this virus from spreading, the better chance we have to limit the mutations that happen and the variants that emerge.
Oh, wow.
So I just wanted to say that it's very important to prevent future variants. We need to just stop the spread.
Right. Wow.
And with that being said, the World Health Organization is definitely monitoring this, but there are some other ones that are being watched very closely.
Right. Okay. I keep hearing that as a country, we have to get to 70 or 80% of the country vaccinated to be safe. I mean, what is that? What does that mean? I don't know what it means.
Yeah, that's a really, really great question. And so what that is saying is that's about the estimated amount of people that need to get vaccinated to achieve something we call herd immunity.
Okay.
And basically that's just meaning that the more people are vaccinated, then that limits the spread of the COVID-19.
Okay.
COVID-19.
Right.
So another way I like to think about it, because we say herd immunity all the time. Here's a way that I like to think about it, because I like pictures and stories. So let's say we're at a family barbecue and there's 100 people. If there are 5 of those people who are sick with COVID-19, all right, and they could potentially spread it around to everybody else. If you have 90 people at that barbecue who are vaccinated and can't get it and spread it to other people, let's say that there are 5 people who are healthy, but they're, for whatever reason, they're children or they can't get vaccinated. If you have 5 people who are sick and 5 people who you're trying to prevent from getting sick, but you have 90 people there who got vaccinated and it can't spread through them, the chances that those 5 people who are sick bumping into the 5 people who you're trying to protect, it's not that likely, because there's so many people in the way who are protected. Now, what if you change that scenario around where there's 5 people who are sick, but then there's only 10 people who got the vaccine? And then all the rest of the people are potentially at risk. At that party, it's very likely that those 5 sick people are gonna bump into the others and come in contact with those who are unprotected. So herd immunity, and when you hear that 70 or 80%, it's just a general number saying this is ideally what we would get to limit the chances of those sick people coming in contact or bumping into, or it being able to spread to those few people who are unvaccinated or unable to be protected. Does that kind of help explain?
That but it also, for me, I just want to get back to going on a cruise. I want to fly without being paranoid.
Yeah.
I want to, yeah, I want to travel, you know,
Yeah.
and so I just want people to get vaccinated so that we can get back to doing the things that we enjoy doing. You know, I wouldn't wish this on anyone, but this is where we're at. But let's get vaccinated so we don't have to. I just want to travel again.
Right.
You know?
Me too.
I don't have to worry. I want to go on a cruise and don't have to worry about getting stuck on an island somewhere because the whole cruise ship is sick. You
Right.
know? So
that really happened.
yeah, but I think one of the things that I hope that people really buy into that this is real. And we cannot gamble with our life, you know, so get vaccinated, you know, let's get our life back, you know.
Yeah, yeah. And I would say there's a lot of people who have fears about the vaccine or hesitations.
Right.
There's a lot that has happened in our history
Yeah.
that give people pause with trust in the healthcare system,
Right.
trust in the public health system. There have been, especially we're talking a lot about Black men's health, there
Right.
have been very unethical and wrong things that have happened to
Yes.
Black men just in general in our nation,
Right.
but also at the in the healthcare field. So for those who are that are hesitant because of that reason, I just want to acknowledge
Yeah.
and say that, okay, your concerns, like I want to listen to them and take them seriously. But what I say is, like you said, we don't want to gamble with our life.
Yes.
Despite what happened in the past,
Right.
we're here at this moment now,
Yes.
and we need to talk about how we're going to have you be here in 20, 30 years from now.
Right.
Yes, there are very rare side effects of the vaccine, but the risks, the very, very small risk of the vaccine do not outweigh the benefits of getting
Right.
vaccinated and protecting yourself, because we know that if you do get COVID-19, the risk of being seriously ill from that is something that you do not want to gamble with. So you have to, no matter what, you're
Yeah.
making a choice and you're taking risks. But I would rather do the thing with the least amount of risk, which
Yes.
at this point is getting the vaccine
Yes.
so I can stay safe.
Let's not look backwards and assess blame. Let's look forward and see what's in front of us,
Yeah.
because again, living is not behind us, living is in front of us. And get vaccinated. I know that I'm going to continue to put this information out. I'm going to do all that I can. Sometimes it feels like you're pushing a very heavy rock uphill, but we got to continue to do it. You know, so
Yes.
yeah.
Well, take care of yourself. I'm so glad to get to have this time with
Yes,
you, and
thank
that we
you.
had this conversation. Let's keep having, we got to do this more.
Oh yeah, yeah. And you know me, I'm always gonna pick your brain. You
Yes.
know, so you might get that call, you know, Dr. Zapata, you know, I got a question, you know. But thank you so much for helping me and educating me, because you know I've been reading up on this, but it's so good to talk with physicians like you that really just give us real information and not fake information that we see floating around. So thank you.
Thank you so much. Take care.